Hello all. Today we can discuss about hemorrhage. First of all, introduction. A hemorrhage is a loss of blood from damaged blood vessels. The bleeding can be trapped inside body, internal hemorrhage that is, or it can flow outside of the body. It's called external hemorrhage. From wound or body opening, the blood loss can be minor or major. The rapid blood loss is medical emergency because body quickly loses blood volume, causing blood pressure to drop sharply. This leads to hypovolemic shock, a life-threatening state where the heart cannot pump enough oxygen carrying blood to sustain vital organs such as brain and spinal cord. Then, definition. The term hemorrhage refers to excess loss of blood during rupture of blood vessels. Natural arrest of hemorrhage. Adequate amount of calcium is required and all clotting factors are essential for the natural arrest of hemorrhage. The blood in the circulation is kept fluid by a fine balance between clotting and fibrinolysis. Next we can see about classification. So in classification, first of all we can discuss about based on source of bleeding. So arterial bleeding, that is bright red in color. Venous bleeding, that is dark red and it will be steady flowing. Then capillary bleeding, it will be slow and oozing. The next, based on location, that is external hemorrhage and internal hemorrhage. And what is this revealed or external hemorrhage? It means it can occur when blood vessels outside the body are damaged, can be caused by cuts, laceration or puncture wounds. Can see outside the body, example cuts and wounds. Then concealed or internal hemorrhage occurs when blood vessels inside the body are damaged, can be difficult to diagnose because symptoms may be subtle or non-specific. It can occur in organs, tissues or cavities, can be caused by trauma or medical illness. Internal bleeding may lead to death within 6 hours of hospitalization. Next we can see about causes. There are many causes of bleeding, but few of the most commonest causes are wounds. Wounds. First, incest wound. Incest wound means it is caused by clean cut or sharp edged object. Then laceration. Laceration means a tear in the skin being hit by something. Then abrasion. Abrasion means scratched or rubbed. Then contusion. Tissue is damaged and bleeds without breaking the skin. Next one is puncture wound. Deep wound caused by sharp object like nails or knife. Then gunshot wound. Fracture of large bones, intraoperative period, road traffic accident, blunt traumatic injury, that is forceful impact. Then invasive diagnostic procedures, anatomical defect, canine bite, crush injury, varicose bleeding. Certain medical conditions like leukemia, liver disease, vitamin K deficiency, brain trauma, thrombocytopenia, that is low blood count, cancers, complications from medical procedures such as childbirth, damage to internal organs, virus that attacks the blood vessels, that like viral hemorrhage fever or dengue hemorrhagic fever. Then certain medications like blood thinners, certain antibiotics, radiation, aspirin and NSAIDs are some of the causes for hemorrhage. Then we can see about the signs and symptoms of hemorrhage. First of all, early signs and symptoms. In hemorrhage, the early signs can be seen like restlessness and anxiety, feeling faint, pallor, feels thirsty, cold to touch, dizziness, nauseous, tired, shortness of breath and weakness. Signs and symptoms in severe hemorrhage. They are extreme pallor, chilled sensation, air hunger, rapid thready pulse, extremely low BP, extreme thirst, diminished urine output. If untreated, it can lead to chest pain, confusion, organ failure and shock. Effects of hemorrhage on cardiovascular system. In cardiovascular system, reduced blood after hemorrhage decreases venous return, ventricular filling and cardiac output. During slow or mild hemorrhage, when there is loss of small amount of blood up to 350 to 500 ml, the blood pressure decreases slightly and soon it returns back to normal. During severe hemorrhage, when hemorrhage is severe with losses of about 1500 to 2000 ml of blood, the arterial blood pressure falls to a great extent. Fainting. When hemorrhage is severe, cardiac output decreases and blood pressure falls, so blood flow to brain decreases, resulting in unconsciousness. Then we can see about diagnosis. In diagnosis of hemorrhage, imaging tests are done like CT, ultrasound, then blood tests. So these blood tests are used to assess blood clotting and other factors. Then angiography. Angiography is used to visualize the blood vessels. Then management. So first of all, we should control the hemorrhage. So hemorrhage is controlled by pad and bandage. It is a simple method of applying direct pressure to a bleeding wound and is applicable to majority of cases. Then elevation of limb. It will control venous hemorrhage. This is classical method of dealing with a sudden hemorrhage from a ruptured varicose vein of leg. Then application of tourniquet, surgical ligation and coagulation. Then pack to control temporary or sudden hemorrhage like gauze, dressing, etc. First aid treatment in case of severe external bleeding. Brings the sides of wound together and press firmly. Press on pressure point for about 10 to 15 minutes. Place the patient in comfortable position and raise the injured part and reassure him. Apply clean pad larger than the wound and press it firmly with palm until bleeding becomes less. If bleeding continues, do not take off original dressing but add more pads. Bandage it but not too tightly. Control of internal hemorrhage. The organ is emptied of blood clots if possible in case of bleeding from bladder. A catheter is passed and bladder is emptied. The vessels are encouraged to contact lots of saline or sodium bicarbonate to which a few drops of adrenaline solution have been added. is of great value in washing the organ. This can be repeated every 2 hours. Surgical ligation can be done in case of ruptured spleen. Fistula treatment in case of severe internal bleeding. Avoid movement, prevents further bleeding. Lay the casualty down with head low. Raise his legs by a pillow if no head injury to improve blood flow. Keep him calm and relaxed. Do not allow to move. Keep up the body heat within blankets or coat. Do not apply ice bag or hot water bag to chest and abdomen. Take him to hospital as early as possible. Monitor vital signs. Watch for signs of shock like low BP, fast pulse and cold skin. An expensive antifibrinolytic drug called tranexamic acid is used to hemorrhage. It increases blood clotting and decreases of fatality in patients with uncontrolled hemorrhage. IV fluids to replace lost fluid and maintain blood pressure. Administrating O2. Embolization. It blocks bleeding of blood vessels. Then blood transfusion. Monitoring, close tracking vital signs. Surgery to repair damaged blood vessels. Vitamin K and fresh frozen plasma. Endoscopy to stop bleeding in digestive tract. Then tourniquets. A tourniquet is a crucial medical device used to control severe bleeding by compressing a limb and restricting blood flow. Uses of tourniquets. Emergency situations, primarily used to stop life-threatening bleeding from limb injuries such as those caused by trauma, accidents or combat, and they are not for minor cuts. It's a crucial tool when direct pressure fails to control bleeding. In surgical procedures, it is used to treat a bloodless surgical field, allowing surgeons to operate with greater precision. Helps minimize blood loss during surgery. Medical procedures. It is used to restrict blood flow when drawing blood. How these tourniquets works. A tourniquet applies circumferential pressure to a limb, compressing the arteries and veins. This pressure temporarily stops blood flow to the area below the tourniquet. Proper application is must. It is essential to apply a tourniquet correctly to maximize effectiveness and minimize complications. So here training is highly recommended. Duration of application. It should not be left in place for extended periods. Prolonged restriction of blood flow can lead to tissue damage. Medical professionals need to assess and manage the situation as quickly as possible. Dangers of using tourniquets. Improper placement. Placing the tourniquet too close to the joint or too far down the limb can reduce its effectiveness and increases the risk of nerve damage. Then insufficient tightening. If it is not tightened enough, it may restrict venous flow but not arterial flow, potentially worsening bleeding. Prolonged application. Prolonged application can lead to tissue ischemia, lack of blood flow, and necrosis, that is tissue death. Nerve damage resulting in permanent paralysis, rhabdomyolysis, that is muscle breakdown, which can lead to kidney damage. Thank you.